All right, welcome. If you're a nursing student and you're about to step into your labor and delivery rotation, then you are in exactly the right place. This is the explainer you've been looking for. We're going to break down the absolute essentials, the core physiology of labor, the fundamentals of pain management, and, this is a big one, the critical skill of fetal monitoring. So let's just dive right in.
So think about this question for a second. It really gets to the core of what an OB nurse does, day in and day out. Because you don't just have one patient, you have two. You've got the mother who's going through this incredibly intense physical and emotional journey. And you've got the fetus. And your job, it's to support mom while, at the exact same time, interpreting these vital signals, this whole story that the baby is telling you. It's an amazing, delicate, and absolutely crucial balancing act.
Okay, so to really get a handle on labor, we've got to start with a solid foundation. And that foundation is what we call the 5 Ps. Seriously, you're going to hear this a lot. Think of them like the key ingredients in a recipe, or maybe the main variables in an equation. They're the things that are going to determine how smoothly, and how quickly, labor is going to go. First up, we have powers. This is literally the engine that drives labor forward. Now, in the first stage, it's all about the uterine contractions. These are totally involuntary, they just happen, and their job is to thin out and open up the cervix. But then, when you get to the second stage, a whole new power joins the party, maternal pushing. This is voluntary, and it works with those contractions to actually bring the baby into the world. It's a 1-2 punch. All right, next P is the passage. This is the actual path the baby has to travel. And let me tell you, it is not a straight shot. It's more like a curved tunnel made up of the bony pelvis and all the soft tissues. And the size and shape of the mother's pelvis, that's a huge deal. It's what determines just how much room that baby has to make its descent. Our third P is the passenger, and that, of course, is the fetus. The baby's position and size are massive factors. Now, the head is the biggest part, right? But here's the cool thing. The skull bones aren't fused yet. They can actually overlap and mold to fit through the passage. It's incredible. And if the baby is in that perfect chin-to-chest, tucked-in position, that presents the smallest possible diameter of the head. And trust me, that can make all the difference. And P number 4 is position. We're talking about the mother's position. Listen, a laboring person is not meant to just lie flat on their back. No way. As their nurse, you are going to be their biggest advocate for moving around, getting upright, kneeling, lying on her side. All of these things use gravity to their advantage. It helps the baby descend, it improves blood flow to the placenta, and it can even shorten labor. It's such a simple, low-tech thing you can do, but it is so powerful. And last but definitely not least, we have psyche. You can never, ever underestimate the power of the mind-body connection in labor. Think about it. When someone is terrified or super anxious, their body floods with stress hormones, right? Those fight or flight hormones. Well, in labor, those hormones can actually work against the uterus. They can make contractions weaker and slow the whole process down. This is where you come in. Your calm presence, your continuous support, it can literally change the hormonal environment. So let's just run through them one more time. We've got powers, passage, passenger, position, and psyche, the 5 Ps. And the key thing to remember is that these aren't separate boxes. They're all interacting all the time. It's like a domino effect. You help a mom change her position, that can open up the passage, which helps the passenger move down, which boosts her psyche because she feels like she's making progress. See how it all connects? Okay, so we have our 5 key components down. Now let's look at how the actual journey unfolds. Labor isn't just one long event. It happens in distinct stages. And, of course, with those stages comes the universal challenge of managing the pain and intensity of it all. So labor is broken down into 4 stages. Stage 1 is the marathon, not the sprint. It's the longest part, and the whole goal is to get that cervix to open all the way up to 10 centimeters. Stage 2 is go time. This is the pushing stage, and it ends when the baby is born. Stage 3 is quick but important, delivering the placenta. And then you have stage 4, which is that super critical first couple of hours of recovery. We're watching mom like a hawk for bleeding and, just as importantly, helping that brand new family start to bond. Now, let's talk about pain. There are basically 2 big toolboxes we can pull from, and, this is key, they can totally be used together. On one side, you have nonpharmacologic methods. Think breathing, relaxation, massage, using a tub. These are all about empowering the mother with coping skills. On the other side, you've got pharmacologic options, like an epidural, which are designed for direct pain relief. Your job is to be the expert guide, to lay out the options, and then fully support whatever path she decides is right for her.
Okay, let's switch gears for a minute. We've talked a lot about mom, now let's focus on the passenger, the baby. When we talk about fetal monitoring during labor, there is one single overarching goal: to see how well the baby is oxygenated. That's it. We're essentially listening in to see how well that baby is handling the stress of contractions. Okay, if you walk away with only one thing from this section, please let it be this: variability. What is it? It's those little jagged up and down fluctuations you see in the fetal heart rate. When you see moderate variability, that's like the baby telling you, hey, my brain and nervous system have plenty of oxygen and everything is working great. It is, without a doubt, the single most important and reassuring sign you can see on a fetal monitor strip. It's the gold standard.
So to make sure everyone is speaking the same language when we look at these monitor strips, we use a 3-tier system. And the easiest way to think about it is like a traffic light. Category 1 is your green light. Everything looks fantastic, we're good to go. Category 2 is the yellow light. Something's a little off. We need to pay close attention and keep a really close eye on things. And category 3, that's your red light. It means stop, we need to do something right now because this baby might be in trouble.
But how do you actually decode all those squiggly lines? Well, there is an absolutely essential mnemonic that every single L&D nurse knows and loves. It's VEAL CHOP. I want you to burn this into your brain. Think of it as your secret decoder ring for linking a specific heart rate pattern to its most likely cause. It's a lifesaver.
Let's break it down. The V in VEAL stands for variable decelerations. These look just like they sound. They're sharp, abrupt, V-shaped drops in the heart rate. And when you see a V, you think C from CHOP, for cord compression. The baby's lifeline, the umbilical cord, is probably getting squeezed. Next up, the E in VEAL is for early decelerations. These are completely different. They're gentle, shallow dips that perfectly mirror the contraction. And what causes them? The H in CHOP, head compression, as the baby's head gets squeezed on its way down. And here's the thing, this is totally normal. It's actually a good sign of progress.
All right, now for the A in VEAL. A is for accelerations. These are those beautiful temporary spikes up in the heart rate. And when you see an A, the baby is O for OK. We love this. It's a fantastic sign that the baby is well oxygenated and happy in there.
And finally, we have L in VEAL, which stands for late decelerations. Now, these are the ones that really get our attention. They're subtle dips, but the timing is everything. They start late after the peak of the contraction, and they recover late. And when you see an L, you have to think P from CHOP, for placental insufficiency. This is a red flag. It tells us the placenta might not be delivering enough oxygen to the baby.
So you've used VEAL CHOP, you've identified a concerning pattern. Great, but now what? Knowing the cause is only half the battle. Knowing what to do about it and doing it fast is everything. So let's talk about your immediate, systematic, first-line responses.
And guess what? We have another amazing mnemonic for this: THOSE. THOSE. These are the core steps for what we call intrauterine resuscitation. So T is for turn the patient onto their side, H is for hydrate with an IV fluid bolus, O is for oxygenate with a mask, S is for stop the oxytocin if it's running, and E, evaluate. You do all that, and then you reassess to see if it worked. This needs to become your muscle memory.
Now, those interventions, they fit into an even bigger picture, a decision-making framework called the ABCD model. Think of it as your strategic plan. A is for assess the entire oxygen pathway. B is for begin your corrective measures. That's your THOSE mnemonic. C is for clear any obstacles to a potentially rapid delivery. And D is for determine the delivery plan with the provider if the baby's heart rate isn't getting better.
And really, this quote just says it all. Your job isn't just to be a technician who reads squiggly lines on a screen. It's so much more than that. It's about blending that high-tech knowledge with high-touch, human-centered care. You're there to keep everyone safe, for sure, but you're also there to protect and honor this incredibly meaningful, life-changing event for that family.
So, as you get ready to start this amazing journey in labor and delivery, I want to leave you with a question to carry with you. You're learning the science, right? You've got the mnemonics, the frameworks, all the physiology. That's your foundation. But the real question is, how are you going to weave all of that science into the art of nursing? How will you be the one who provides that truly holistic, compassionate, and family-centered care? That's your challenge, and it's the most rewarding part of the job.